There are 5 routine medical checkups that seniors over 70 should reevaluate. These tests are often presented as protective, but scientific data shows they may create more harm than benefit. Most doctors do not disclose this risk clearly. Every year, millions of seniors follow standard screening protocols, assuming these tests guarantee safety. However, new evidence reveals that up to 37% of all medical tests in older adults lead to unnecessary treatment complications or lifelong side effects. Despite this, 99% of people over 70 are unaware they are being exposed to overtreatment through excessive screening. Pay attention to this. The first test on our list is now estimated to account for 5% of all cancer cases in the United States, equivalent to the cancer burden caused by drinking alcohol daily. This statistic is not advertised in hospitals, but it is documented in published medical research. In this video, I will identify the 5 tests that require caution after age 70 and explain the real risk behind each one. Every point is backed by real-world data, not opinion. The second test in particular will challenge common beliefs about medical prevention. Before we proceed, I need 3 details from you in the comments: your location, your age, and whether you have ever regretted a medical test or procedure. Do you believe seniors are being tested too aggressively? I will personally review and respond with direct medical guidance. If you want more clear database discussions like this, subscribe and continue watching. Let's start with the first test. It appears harmless, yet it has a measurable potential to reduce your quality of life, and you need to understand exactly how. Number 5, the bone density scan. The name sounds harmless. It's a quick, non-invasive imaging test. There are no injections, no pain involved, and you walk out with a numerical report on bone strength and fracture risk. Here is the part that is usually left out. After age 70, this scan triggers more fear than it delivers practical medical benefit. The DEXA scan is designed to assess bone structure and flag osteoporosis. That is its intended clinical use. But in adults beyond 70, especially women, the scan almost always reports a number below a youthful average, even when the fracture risk is functionally low. This happens for one simple reason: bone density naturally declines with age. It is not a disease pattern. It is a physiological shift just as predictable as skin thinning or hair turning gray. Despite that, many seniors are immediately directed into drug treatment, typically bisphosphonates. These medications are engineered to slow bone breakdown, but they come with well-documented systemic risks, including jaw necrosis and aggressive irritation of the esophagus. This is where you need to pause and question the logic. What exactly justified the scan? Did you fall recently? Do you have new localized bone pain? Or was this just a routine screening with no symptoms involved? Clinical data is unambiguous. Treating mild bone loss in patients over 70 produces minimal impact on real-world fracture statistics. One major study published in the Journal of the American Geriatric Society observed over 200 women aged 70 and above for 5 years. The reduction in fracture risk from bisphosphonate use was 0.3%. That number is not zero, but it is clinically marginal and does not justify the burden of side effects for most functional adults. Meanwhile, the same group experienced a higher rate of medication complications, digestive irritation, esophageal inflammation, and atypical fracture patterns in low-impact zones. Consider Rose, age 76, retired piano instructor. She had no falls, no pain, and maintained daily walking. Her scan showed osteopenia, a mild decrease in density, not qualifying as osteoporosis. She was prescribed alendronate immediately. Within 12 weeks, she developed severe acid reflux and sharp jaw pain. By the time she consulted me, she had stopped playing piano altogether because of the discomfort. I asked one question: was there any impairment in daily function? She confirmed none. We discontinued the drug immediately and focused strictly on vitamin D correction, structured resistance training, and a calcium-centered diet using sardines and leafy greens. 12 months later, she regained strength, reported no fractures, and returned to her piano practice. This is the core message. A scan can feel responsible, but for seniors who are mobile, not experiencing falls, and not reporting pain. Lifestyle-based strengthening is the superior approach. Strength training, balance conditioning, focused nutrition, and correcting vitamin D deficiency have been proven to reduce fracture risk by more than 20%. That result was published in Osteoporosis International in 2022. Do not let a number on a diagnostic screen push you toward unnecessary pharmaceutical intervention. Medication has its place, but not as a reflexive response to a routine scan in a stable, functional adult. There is, however, another type of scan that leads to consequences far more severe than digestive irritation or jaw pain, one that may end in brain surgery. That is where we go next. Number 4, brain MRI for memory loss. When an older adult starts noticing occasional forgetfulness or brief moments of confusion, the immediate reaction is fear. Fear of dementia, fear of Alzheimer's. Most doctors respond by ordering a brain MRI without delay. Here is what you need to confront. An MRI gives extremely detailed images of the brain structure, but in cases of mild cognitive complaints, it almost never delivers the conclusive or actionable answers patients expect. In people over 70, most MRI scans reveal routine age-related patterns, slight brain shrinkage, or small white matter spots that are considered normal in aging brains. The real problem begins once these harmless spots are seen. The moment they appear on a scan, they trigger a chain reaction of anxiety. Additional testing and, in some cases, unnecessary surgery interventions that offer no improvement in memory and can worsen overall health. Let's look at actual data. A 2021 review in Neurology Today analyzed more than 3,000 MRI scans from patients aged 70 to 85 who reported only mild memory concerns. 86% of those scans displayed so-called abnormalities, yet only 3% of those findings were tied to real treatable conditions. That means 97% of people were told either directly or indirectly that something was wrong with their brain, even though clinically there was no meaningful pathology. Before you agree to an MRI, ask yourself clearly: are you unable to perform tasks you once handled easily, such as organizing finances or following step-by-step instructions, if not understand what follows? Nearly 12% of patients in that same study were then pushed toward invasive procedures, spinal taps, exploratory brain biopsies based solely on vague MRI observations. Consider George, age 74, a retired engineer. He was concerned about misplacing his keys and occasionally forgetting names. His previous physician ordered an MRI. The report mentioned white matter changes, and he instantly assumed he had early-stage dementia. He stopped driving, withdrew from community activities, and his anxiety escalated quickly. Ask yourself, are you unable to complete conversations without losing track? Or are others noticing a serious change in your ability to process information? When George came to me, we conducted a standardized cognitive screening. His scores were fully within normal limits. We explained that his MRI results were typical for his age. Instead of chasing meaningless scan findings, we redirected him toward practical measures: sleep regulation, consistent hydration, and structured cognitive exercises. Within 3 months, his memory stabilized, and he returned to normal activities. Here is the clinical bottom line. Unless a patient shows severe neurological warning signs, such as seizures, sudden personality shifts, or a rapid breakdown in daily function, MRI scans rarely provide useful guidance in mild memory concerns. The correct initial approach is a structured cognitive screening test. It is simple, paper-based, inexpensive, clinically accurate, and eliminates the risk of triggering panic and invasive medical follow-up. Now prepare yourself. The next test on this list is one you have likely experienced several times, and there is a clear medical reason it ranks at number 3. Number 3, the cardiac stress test. This test is one of the most commonly ordered diagnostics for seniors who report vague symptoms: slight fatigue, occasional chest tightness, or simply saying they don't feel like they used to. The cardiac stress test evaluates heart function while you walk on a treadmill or after a drug is administered to mimic exertion. Its intended purpose is to detect blocked coronary arteries. Here is the issue. Once you are over 70, using this test on individuals without clear, definitive signs of serious heart disease introduces more risk than clinical benefit. Ask yourself plainly, do you become short of breath only when actively exerting yourself? Or are you just generally tired? The real danger lies in what happens after the test. Stress tests in seniors have a high rate of false positives test results that suggest a blockage even when there is none. In people over 70, studies confirm that this false alarm rate can reach 40%. This leads directly to a cascade of aggressive follow-up procedures such as angiograms and, in many cases, unnecessary stent placement or even bypass surgery. A 2017 JAMA cardiology study revealed that more than half of the stents placed due to referrals from stress tests were done on patients who did not have true disabling symptoms, and they gained no survival advantage or improvement in quality of life after the intervention. Consider your situation carefully. Have your symptoms progressively worsened over recent months, or have they stayed stable and mild? What many of those patients did experience, according to the same data, were higher rates of severe bleeding kidney damage caused by contrast dye and extended hospitalization. This scenario played out for Raymond, 75, a retired postal worker who maintained daily walks. During a routine appointment, he casually mentioned mild fatigue when climbing steep hills. His doctor ordered a stress test just to be safe. The results were unclear, leading to a catheter-based angiogram. A minor narrowing was found and a stent was inserted. That night, Raymond developed a serious reaction to the contrast dye and suffered acute kidney injury. He spent 6 days hospitalized and needed weeks of follow-up care. His original fatigue never improved because it wasn't cardiac. In origin, he simply needed better hydration and more structured rest between activities. Understand this clearly. If you are over 70 and are not experiencing unmistakable heart-related symptoms, such as crushing chest pain during activity, noticeable breathlessness on mild exertion, or a significant drop in energy during basic tasks, then a stress test carries a high likelihood of creating more harm than medical advantage. Safer and more rational alternatives exist. A resting EKG can assess your heart rhythm quickly while you are still. Another option is a coronary calcium scan, a low-radiation imaging test that clearly shows whether hardened dangerous plaque is building up in your arteries. These tests are far less likely to force you toward invasive high-risk procedures that you never needed in the first place. These tests are far less likely to force you toward invasive high-risk procedures that you never needed in the first place. Number 2, the colonoscopy. You may not have expected this test to appear on this list, but it needs to be addressed without hesitation. A colonoscopy, where a flexible camera is navigated through the entire colon to inspect for abnormalities, is not automatically a medically sound choice after age 70. After age 75, it is almost never clinically justified, unless you are showing specific worrisome gastrointestinal symptoms. The risk profile changes sharply with age. The preparation alone is harsh. You are required to take aggressive laxatives that can trigger severe dehydration, dizziness, kidney strain, and electrolyte imbalance. On top of that, the sedation used during the procedure introduces additional cognitive and neurological risk in older adults. Before agreeing to a colonoscopy, ask yourself, have you actually experienced any changes in stool color, stool texture, or bowel movement frequency? Here is another issue that is rarely mentioned up front. The procedure itself can cause direct physical complications. These include internal bleeding, perforation of the colon wall, and even dangerous disruptions in heart rhythm triggered by the sedation process. A 2019 study published in JAMA Internal Medicine tracked more than 1.3 million Medicare patients aged 70 and older. The data showed that among patients over 75, only 2 lives were saved for every 1,000 colonoscopies performed, yet more than 20 individuals suffered serious health complications. That creates a 10-to-1 ratio of harm to benefit. Now consider your own situation. Are you currently dealing with unexplained abdominal pain or visible blood in your stool? Even when a small polyp is found and removed, keep in mind that many polyps in very old adults are biologically slow-growing and not immediately dangerous. Removing them aggressively in someone who is older or physiologically fragile can cause more damage in the short term than simply monitoring them over time. Donna, age 73, is a clear example. She co-managed a busy bakery with her daughter. She had no symptoms, no bleeding, no bowel changes, and no family history of colon cancer. A newly trained doctor pushed her toward a screening colonoscopy. She agreed, despite her hesitation. A small polyp was removed and she was discharged. That same night, she collapsed from severe abdominal pain. In the hospital, doctors confirmed a bowel perforation. She required 9 days of intensive recovery, lost 10 pounds, and her overall health stability has been compromised ever since. Think clearly. When was your last colonoscopy, and were there any abnormal findings then? When her records were fully reviewed, we found she had already undergone 2 completely clear colonoscopies in previous years. There was no medical basis for repeating the test again. Current guidance from the U.S. Preventive Services Task Force USPSTF states that routine colon cancer screening should stop for most adults at age 75. For seniors who are still in excellent health and want screening, a non-invasive stool-based test, such as the FIT test, is a far safer and more rational option. You perform it at home. There is no prep, no sedation, and it still effectively detects high-risk cancers. Make sure to speak directly and assertively to your doctor about these alternatives. Once you step into the invasive colonoscopy pathway, it is extremely difficult to step back out. Now we reach the final test, the one that is ordered more than any other, the one that carries the highest potential for long-term harm, and the one you have almost certainly undergone. Number 1. The annual full-body CT scan. Full-body CT scans are heavily marketed under labels like executive health package or preventive screening, often positioned as the most advanced way to detect cancer early. Here is the reality you need to acknowledge immediately. These scans expose your body to a high dose of ionizing radiation. For individuals over 70, that exposure sharply increases the risk of unnecessary follow-up imaging, invasive biopsies, and even major surgeries that you never needed. Before agreeing to any scan, ask yourself directly, are you experiencing unexplained weight loss, persistent night sweats, or a new lasting cough? If the answer is no, understand what you're stepping into. The hard fact is this: there is no credible medical evidence showing that full-body CT scans in symptom-free individuals extend lifespan or prevent cancer deaths. Each scan delivers between 10 to 20 millisieverts of radiation, the equivalent of nearly 500 chest X-rays at once. A 2023 modeling study published in JAMA Internal Medicine reported that the dramatic increase in CT scan usage in the United States may now account for up to 5% of all new cancer cases, placing medical imaging in the same cancer-causing category as alcohol consumption. That means 1 in every 20 cancers may be triggered by the very test marketed as preventive. These scans are extremely good at detecting harmless age-related nodules, calcifications, or cysts that pose no real threat. But once these insignificant findings appear on a radiology report, physicians are obligated to act. That leads to more imaging than biopsies, and the patient is pushed into a medical spiral based on a meaningless discovery. Marcus, 80, is an example you need to consider. He was active, healthy, and still teaching martial arts to seniors. He paid for a luxury senior elite screening at a private clinic. A tiny 3mm lung nodule appeared on the scan. That one finding triggered specialist referrals, a PET scan, and eventually a needle biopsy. The biopsy caused a partial lung collapse. He was rushed to the hospital and spent 2 months recovering. The final diagnosis: benign tissue that would never have harmed him. Before you agree to a scan, ask clearly: did your doctor explain the false positive risk and the exact chain of events that will follow if something minor is detected? All of this occurred because of a finding that required no intervention at all. Leading expert bodies now issue clear guidance. Full-body CT scans must not be used for routine screening in symptom-free adults. The American College of Radiology ACR states, "There is no proven benefit and a high potential for harm if you have serious defined warning signs, unexplained weight loss, coughing, blood, a visible lump that isn't healing, then a targeted symptom-focused scan is medically appropriate. But scanning the entire body without reason is equivalent to using a landmine detector to hunt for treasure. You may locate something, but you risk far more damage than the condition you were trying to avoid. A better approach is simple. Monitor your body honestly. Have open, structured conversations with your primary doctor. Agree only to tests that have a clear, justifiable purpose. Your energy, your time, and your remaining years are too valuable to spend recovering from complications caused by fear-driven screenings. You have now seen 5 commonly celebrated medical checkups that are widely offered to seniors, but can become serious threats once you pass age 70. Modern medicine is powerful, but it is not flawless. In many situations, restraint is the smartest medical decision you can make. Before agreeing to any test, always ask one direct question. If this scan finds something, what exactly happens next? If the answer is vague, or if the follow-up path introduces more risk, then the potential benefit of detecting a non-lethal issue, early step back and rethink your decision. Real prevention is not found in machines. It is built through movement, disciplined nutrition, restorative sleep, and strategic, thoughtful medical choices. Now I want your input. Have you or someone you know suffered complications from a test or procedure that turned out to be unnecessary? What happened? And what was the outcome? Share it. Your story might protect someone else from going down the same path.